Hello friends, so today I am going to talk about one condition which looks like epilepsy but it is not epilepsy, and that condition is called as non-epileptic attacks, or also called as psychogenic non-epileptic seizures. So basically when we talk about epilepsy, it's a brain disease which occurs due to abnormal electrical discharges in the brain, and the person has jerky movements of the hands and legs, tongue bite, and they can fall and get injured also, and that is all well known. But sometimes the symptoms can be very similar, where the person seems to be losing awareness. The person can have jerking movements of the body also, but at the same time, it is not epilepsy. So, how do we clinically say that this could be psychogenic and not the true epilepsy? What we talk about. So, the number one is that patients may be having prolonged seizure attacks. So, it can go on for several minutes or several hours, and other thing is that as soon as the seizures stop, the person would be still fully conscious, whereas in a true epilepsy or the epilepsy, we find that immediately after the seizure the person may be still drowsy or disoriented or confused. So that is called as post-ictal confusion, which is not seen in the psychogenic epilepsy cases. And other thing is that they generally tend to happen in presence of others, whereas epilepsy doesn't have any such limitation. It can happen anywhere. And then the third thing is when you ask the person that whether you are fully conscious, so they may not be able to speak. At the same time, they may say that yes, I could hear some sounds, or some things like that, whereas in a true epilepsy, the person cannot speak and also cannot hear because that person is fully unconscious. So these are few of the things. We also say that if somebody has tongue bite or has passed urine during the attack, or falls and gets injured, they are generally suggestive of epilepsy and not psychogenic seizures. But sometimes in non-epileptic attacks also these things can happen. But always, you can't be sure 100% clinically. So what we do is in the clinic setup, we take a detailed history. In a psychogenic or non-epileptic attacks, there'll be psychiatric disturbances, there'll be stress, or some psychological issues going on, which converts into a physical symptom. So that if we can get that, that is well and good. Otherwise, we go for something called as prolonged EEG, where during the abnormal attacks, if the EEG is normal, we can be very sure that it is psychogenic epilepsy and not other epilepsy that we commonly see. The differentiating this from the other epilepsy is very important because treatments are different. If we just give anti-seizure medication for non-epileptic attacks also, the person will not improve. So we need to also identify the psychological issues and diseases and also tackle them. Only then the person can have complete benefit. So I hope you learned something new from this and you enjoyed it. Thanks.